Have you noticed your hair becoming thinner lately? You're not alone. Hair thinning is a common concern for many people, regardless of age or gender. In this video, we'll explore the reasons behind hair thinning and discuss practical steps you can take to address it. We'll break down the science, look at lifestyle factors, and provide actionable solutions. Whether you're experiencing gradual thinning or sudden hair loss, understanding the causes is the first step toward healthier hair. Let's start by looking at what hair thinning actually means and how it differs from other types of hair loss. Hair thinning refers to a gradual reduction in the density or volume of your hair. Unlike bald patches or complete hair loss, thinning usually means your hair strands become finer and the scalp may become more visible over time. This process can happen slowly, making it hard to notice at first. Both men and women can experience hair thinning, and it can affect any part of the scalp. Understanding this distinction is important because it helps you identify the right approach to treatment. Next, let's explore the most common causes behind thinning hair. One of the leading causes of hair thinning is genetics. If your parents or grandparents experienced thinning hair, you may be more likely to notice it yourself. This type of hair loss is often called androgenetic alopecia, or pattern hair loss. It typically progresses gradually and can start as early as your teens or 20s. While you can't change your genes, understanding your family history can help you anticipate and manage thinning hair more effectively. In the next scene, we'll look at how hormonal changes can also play a significant role. Hormones have a powerful impact on hair growth and loss. Changes in hormone levels, such as those that occur during pregnancy, menopause, or thyroid disorders, can trigger hair thinning. For example, after childbirth, many women experience temporary shedding due to shifting hormone levels. Similarly, imbalances in thyroid hormones can disrupt the hair growth cycle, leading to thinning. If you suspect hormonal issues, it's important to consult a healthcare professional for proper diagnosis and treatment. Next, let's discuss how stress can affect your hair. Stress is another major contributor to hair thinning. When you're under physical or emotional stress, your body can push more hair follicles into the shedding phase, a condition known as telogen effluvium. This can result in noticeable thinning a few months after a stressful event. The good news is that stress-related hair loss is often temporary, and hair can regrow once the stress is managed. Practicing relaxation techniques, getting enough sleep, and maintaining a healthy lifestyle can all help reduce stress and support hair health. Your diet plays a crucial role in hair health. Deficiencies in key nutrients like iron, zinc, vitamin D, and protein can lead to hair thinning. For example, iron deficiency anemia is a common cause of hair loss, especially in women. Without enough nutrients, hair follicles may become weak, and new hair growth can slow down. Eating a balanced diet rich in vitamins and minerals is essential for maintaining strong, healthy hair. In the next scene, we'll look at how certain medical conditions can also contribute to thinning hair. Certain medical conditions can directly or indirectly cause hair thinning. Autoimmune diseases like alopecia areata, scalp infections, and chronic illnesses can disrupt the normal hair growth cycle. Additionally, conditions such as polycystic ovary syndrome, PCOS, and lupus are known to affect hair health. If you have an underlying medical issue, treating the root cause is often the most effective way to restore hair growth. Always consult with your doctor if you suspect a medical condition is affecting your hair. Some medications can have side effects that include hair thinning. Common culprits include chemotherapy drugs, blood thinners, antidepressants, and medications for high blood pressure. If you notice hair thinning after starting a new medication, talk to your healthcare provider. They may be able to adjust your dosage or suggest alternatives. Never stop taking prescribed medication without consulting your doctor. Next, let's examine how hair care practices can also influence hair thickness. The way you treat your hair can have a big impact on its thickness and overall health. Frequent use of heat styling tools, harsh chemical treatments, tight hairstyles, and excessive brushing can all contribute to hair thinning. Over time, these practices can weaken hair strands and damage the scalp. To protect your hair, try to minimize heat exposure, avoid harsh chemicals, and choose gentle hair care products. Let's now look at how age naturally affects hair density. As we age, it's natural for hair to become thinner. The hair growth cycle slows down, and hair follicles may shrink, producing finer, shorter hairs. This process is a normal part of aging and affects everyone to some degree. While you can't stop aging, you can take steps to support hair health and slow down the thinning process. In the next scenes, we'll discuss practical solutions and lifestyle changes that can help you maintain fuller hair for longer. If you're concerned about hair thinning, the first step is to get a proper diagnosis. A healthcare provider or dermatologist can examine your scalp, review your medical history, and may order blood tests to check for underlying conditions. Sometimes, a scalp biopsy is needed to determine the exact cause. Accurate diagnosis is essential for choosing the right treatment and avoiding unnecessary products or procedures. Next, let's talk about lifestyle changes that can support hair health. A balanced diet is one of the most important factors for healthy hair. Focus on foods rich in protein, iron, zinc, and vitamins A, C, D, and E. Leafy greens, eggs, nuts, seeds, fish, and lean meats are excellent choices. Staying hydrated is also crucial, as dehydration can make hair more brittle. If you suspect a deficiency, consider talking to your doctor about supplements. Next, we'll look at how gentle hair care routines can make a difference. Switching to a gentle hair care routine can help prevent further thinning. Use mild shampoos and conditioners, avoid washing your hair with very hot water, and let your hair air dry when possible. Limit the use of heat styling tools and harsh chemicals. When brushing, use a wide-tooth comb to minimize breakage. These small changes can make a big difference in the long run. Next, let's discuss the importance of scalp health. A healthy scalp is the foundation for healthy hair. Keep your scalp clean and free from buildup by washing regularly with gentle products. Avoid scratching or picking at your scalp, as this can cause irritation and damage hair follicles. Massaging your scalp can improve blood circulation and promote hair growth. If you have dandruff or other scalp conditions, seek appropriate treatment. Next, we'll explore the role of stress management in supporting hair health. Managing stress is essential for both your overall well-being and your hair health. Chronic stress can disrupt the hair growth cycle and lead to thinning. Incorporate stress-reducing activities into your daily routine, such as exercise, meditation, yoga, or spending time with loved ones. Adequate sleep and relaxation are also important. By taking care of your mental health, you can create a better environment for hair growth. Next, let's look at medical treatments available for hair thinning. There are several topical treatments available for hair thinning. Minoxidil is one of the most widely used over-the-counter solutions. It works by stimulating hair follicles and prolonging the growth phase. Apply it directly to the scalp as directed. Some people may experience mild side effects like scalp irritation, so it's important to follow instructions carefully. Results can take several months to become noticeable. Next, we'll discuss oral medications that may help with hair thinning. For some types of hair thinning, oral medications may be prescribed. Finasteride is commonly used for male pattern baldness, while spironolactone may be recommended for women with hormonal hair loss. These medications work by blocking hormones that contribute to hair thinning. Like all medications, they can have side effects and should only be taken under medical supervision. Always discuss the risks and benefits with your doctor before starting any new medication. Next, let's look at advanced treatment options. Platelet-rich plasma, PRP, therapy is an advanced treatment for hair thinning. It involves drawing a small amount of your blood, processing it to concentrate the platelets, and injecting it into your scalp. The growth factors in PRP are believed to stimulate hair follicles and promote new growth. While some people see positive results, PRP therapy is not guaranteed to work for everyone and can be expensive. Always consult a qualified professional before considering this option. Next, we'll discuss hair transplants. Hair transplant surgery is a more permanent solution for some people with significant hair thinning. The procedure involves moving hair follicles from one part of the scalp to areas where hair is thinner. Results can be natural-looking, but the process is invasive and requires recovery time. Not everyone is a good candidate for hair transplants, so a thorough evaluation by a specialist is necessary. In the next scene, we'll look at non-medical ways to improve the appearance of thinning hair. If you're looking for immediate ways to make your hair appear fuller, there are several cosmetic options. Volumizing shampoos, conditioners, and styling products can help add body to your hair. Hair fibers and powders can temporarily cover thinning areas, making the scalp less visible. Choosing the right haircut and hairstyle can also create the illusion of thicker hair. These solutions don't address the underlying cause, but can boost your confidence while you work on long-term strategies. Supplements can support hair health, especially if you have a deficiency. Biotin, iron, zinc, and vitamin D are commonly recommended. However, taking excessive supplements can be harmful, so it's best to get tested and follow your doctor's advice. Supplements work best when combined with a healthy diet and lifestyle. Next, let's discuss the importance of avoiding damaging habits that can worsen hair thinning. Certain habits can make hair thinning worse. Avoid tight hairstyles like ponytails or braids that pull on the hair. Limit the use of harsh hair dyes, bleaches, and chemical straighteners. Try not to brush your hair when it's wet, as it's more prone to breakage. Protect your hair from excessive sun exposure and chlorine in swimming pools. By being mindful of these habits, you can help preserve your hair's strength and thickness. Smoking has a negative effect on hair health. It reduces blood flow to the scalp, depriving hair follicles of essential nutrients and oxygen. Over time, this can contribute to hair thinning and slower growth. Quitting smoking not only benefits your overall health, but can also improve the condition of your hair. Next, let's talk about the importance of regular checkups for maintaining hair health. Regular health checkups can help identify underlying issues that may contribute to hair thinning. Routine blood tests can detect deficiencies or hormonal imbalances early. Discuss any changes in your hair with your healthcare provider, as it can be a sign of broader health concerns. Early intervention is key to preventing further thinning and promoting regrowth. In the next scene, we'll look at myths and misconceptions about hair thinning. There are many myths about hair thinning, such as the belief that wearing hats causes hair loss or that frequent washing makes hair fall out. In reality, these factors have little to no impact on hair thinning. Genetics, health, and lifestyle play much bigger roles. It's important to separate fact from fiction so you can focus on effective solutions. Next, we'll discuss when to seek professional help for hair thinning. If you notice sudden or severe hair thinning, bald patches, or other unusual symptoms, it's time to see a specialist. Dermatologists are experts in diagnosing and treating hair and scalp conditions. Early intervention can make a big difference in the outcome. Don't hesitate to seek help if you're concerned about your hair. In the next scenes, we'll answer some frequently asked questions about hair thinning. Many people wonder if hair thinning can be reversed. The answer depends on the cause. If thinning is due to temporary factors like stress or nutritional deficiencies, hair can often regrow once the issue is resolved. For genetic or age-related thinning, treatments can slow the process and improve appearance, but full reversal may not be possible. Consistency with treatment and healthy habits is key. Next, let's answer another common question about hair products. Some hair products can help improve the appearance of thinning hair, but they don't address the root cause. Volumizing shampoos and conditioners can make hair look fuller, while medicated products like minoxidil can support regrowth in some cases. Always choose products suited to your hair type and avoid harsh chemicals. Next, let's discuss how long it takes to see results from hair thinning treatments. Patience is important when treating hair thinning. Most treatments, whether topical or oral, take several months to show noticeable results. Hair grows slowly, so it's normal to wait 3 to 6 months before seeing improvement. Consistency with your chosen treatment and healthy habits will give you the best chance of success. In the next scene, we'll talk about the importance of self-care and confidence during this journey. Dealing with hair thinning can be emotionally challenging. Remember that your self-worth isn't defined by your hair. Focus on self-care, surround yourself with supportive people, and consider talking to a counselor if you're struggling. Embracing your appearance and finding styles that make you feel confident can make a big difference. Next, let's look at how to track your progress during treatment. Keeping track of your hair's condition can help you see improvements over time. Take regular photos of your scalp and hair and note any changes in thickness or shedding. This can help you and your healthcare provider assess the effectiveness of treatments and make adjustments if needed. Tracking progress can also keep you motivated on your journey to healthier hair. Next, we'll discuss the importance of realistic expectations. It's important to set realistic expectations when addressing hair thinning. Not all treatments work for everyone, and results can vary based on the underlying cause. Some improvement is possible, but complete restoration may not be achievable. Focus on the progress you make and celebrate small victories along the way. Next, let's look at the role of genetics in more detail. Genetics play a significant role in determining your hair's thickness and growth pattern. If you have a family history of thinning hair, you may be more likely to experience it yourself. While you can't change your genes, you can take steps to slow the process and improve hair health. Understanding your genetic predisposition can help you choose the most effective treatments and set realistic goals. Next, let's discuss the importance of early intervention. Addressing hair thinning early can make a big difference in outcomes. The sooner you identify the cause and start appropriate treatment, the better your chances of slowing or reversing the process. Don't wait until thinning becomes severe. Take action as soon as you notice changes. Early intervention can also prevent further damage and boost your confidence. Next, we'll explore the science behind the hair growth cycle. Hair grows in cycles, including the anagen growth, catagen transition, and telogen resting phases. Most hair is in the growth phase at any given time. Disruptions to this cycle, such as stress or illness, can push more hairs into the resting phase, leading to shedding and thinning. Understanding the hair growth cycle can help you make sense of why thinning occurs and how treatments work. Next, let's look at how hormones affect this cycle. Hormones like androgens and estrogens play a key role in regulating the hair growth cycle. High levels of androgens can shrink hair follicles and shorten the growth phase, leading to thinning. Hormonal changes during puberty, pregnancy, menopause, or due to medical conditions can all impact hair health. Understanding your hormonal profile can help guide treatment decisions. Next, let's discuss the importance of sleep for hair health. Quality sleep is essential for overall health, including your hair. During deep sleep, the body repairs and regenerates tissues, including hair follicles. Chronic sleep deprivation can disrupt hormone levels and increase stress, both of which can contribute to hair thinning. Aim for 7-9 hours of sleep each night to support healthy hair growth. Next, let's look at the role of hydration in maintaining hair strength. Staying hydrated is important for strong, healthy hair. Water helps transport nutrients to hair follicles and keeps the scalp moisturized. Dehydration can make hair dry, brittle, and more prone to breakage. Make sure to drink enough water throughout the day, especially if you're physically active or live in a hot climate. Next, let's discuss the impact of environmental factors on hair thinning. Environmental factors like pollution, sun exposure, and harsh weather can damage hair and contribute to thinning. Pollutants can build up on the scalp, while UV rays can weaken hair strands. Protect your hair by wearing hats, using UV protectant sprays, and washing regularly to remove buildup. Being mindful of your environment can help you maintain healthier hair. Next, let's look at the benefits of regular scalp massages. Regular scalp massages can improve blood circulation, relax the scalp, and promote hair growth. Use your fingertips to gently massage your scalp for a few minutes each day. You can also use oils like coconut or argan oil for added nourishment. Scalp massage is a simple, cost-effective way to support hair health and reduce stress. Next, let's discuss the importance of choosing the right hair products. Selecting the right hair care products is crucial for managing thinning hair. Look for shampoos and conditioners that are free from sulfates and harsh chemicals. Products with ingredients like biotin, keratin, and natural oils can help strengthen hair. Avoid heavy styling products that can weigh hair down or cause buildup. Experiment to find what works best for your hair type. Next, let's talk about the importance of regular trims. Getting regular trims helps prevent split ends and breakage, which can make hair appear thinner. Even if you're trying to grow your hair, trimming every 6-8 weeks keeps it looking healthy and full. Ask your stylist for advice on the best cut for your hair type and thinning pattern. Next, let's discuss how to cope emotionally with hair thinning. Hair thinning can affect your self-esteem and emotional well-being. It's normal to feel frustrated or anxious about changes in your appearance. Reach out to friends, family, or support groups for encouragement. Remember, you're not alone, and many people experience similar challenges. Focusing on self-care and positive habits can help you feel more confident. Next, let's summarize the key takeaways from this video. To sum up, hair thinning can be caused by genetics, hormones, stress, nutrition, and lifestyle factors. Early diagnosis and intervention are crucial for the best results. Focus on a healthy diet, gentle hair care, stress management, and appropriate treatments. Remember, you have options, and support is available. In our final scene, we'll encourage you to take proactive steps toward healthier hair. Now that you understand the causes and solutions for hair thinning, it's time to take action. Start by evaluating your habits, making healthy changes, and seeking professional advice if needed. Remember, progress takes time, but every step you take brings you closer to healthier, fuller hair. Stay positive and patient on your journey. Thank you for watching, and take care of your hair and yourself.